Hey, we're here at Sanford Power in Fargo with Dr. Robin Knutson-Buehling. Doctor, there's been a lot of discussions lately about concussions. What can you tell us about them, and what should parents know about them?
Well, the first thing that parents really need to know about concussions is that it's really important to have them evaluated. So if they have a concern, if their child has hit their head or they're complaining about headache or dizziness, to be sure to have them evaluated, perhaps by their athletic trainer at the school or by one of the physicians in the clinic. Once they are evaluated, we use a number of physical and cognitive tests to decide if they have a concussion, and if that is deemed to be the case, then we would work with them with school accommodations or exercise limitations to help them get back to their sport and to get back to school.
Dr. Robin, thanks so much for your time.
Thanks for having me.
Exceed yesterday. Choose Sanford Orthopedics and Sports Medicine.
This Sports Minute has been brought to you by the experts at Sanford Orthopedics and Sports Medicine.
We're at Sanford Power in Fargo with Dr. Mark Lundeen. Dr. Lundeen, a scene that parents do not want to see is their athlete involved in a collision. They fall to the ground, grab their knee in pain. When that athlete comes to Sanford Orthopedics and Sports Medicine, what can they expect?
The care of the athlete actually begins at the time of the injury, because Sanford is the largest employer of certified athletic trainers in the United States today. So the majority of all of the games that are being played in this area now are covered by an expert in assessing the injury. After that, they have a mechanism to bring them into the orthopedic clinic, where the athlete is evaluated by a very passionate and knowledgeable group of experts in the extent of the injury, to map out the best treatment strategy to get the best possible result and the quickest return to play that the athlete can have.
I'm here at Sanford Power in Fargo with Dr. Ben Noonan. Dr. Noonan, a lot of people talking about hip impingements as of late. What are they, and what should parents know about them?
Yeah, thanks, Chris. So hip impingement is a fairly new diagnosis in orthopedic sports medicine. And really, in a nutshell, it's anything that leads to increased contact or collision between the cup of the hip joint and the femoral neck. Now, athletes will often complain of pain in the front of their hip with repeated high-intensity activities. When they come in to see me, we try to do a multitude of tests to figure out what's causing their pain. And then we always start with a good course of physical therapy at a place like the Power Center here to see if we can address muscle imbalances and stiffness. We try rest, anti-inflammatories, and then if all that fails, in the right athletes, we'll talk about arthroscopic surgical intervention, or we'll fix these bony abnormalities. And the good thing is almost all of the athletes, even if they come to that, can get back to their sport at a pretty high level.
This Sports Minute has been brought to you by the experts at Sanford Orthopedics and Sports Medicine.
We're here at Sanford Power in Fargo with Dr. Kevin Dahl. Dr. Dahl, shoulder injuries have become much more prominent as of late, long-term problems. How does Sanford Orthopedics typically solve these situations?
Well, it all starts with the patient's clinic visit. My goal is to give the patient enough time to thoroughly discuss their concerns, achieve a thorough diagnosis, and come to the correct diagnosis. We have state-of-the-art imaging modalities to aid us in this if needed. If surgery is indicated, we generally use minimally invasive arthroscopic techniques, as well as the latest in implant technology to minimize postoperative pain, which I feel allows for a quicker return to, or a quicker transition to therapy and recovery. From there, we work with an excellent group of physical therapists to make sure the patient maximizes their functional potential during the healing process. We also utilize the Return to Performance program at the Sanford Power Center. This gives the patient an excellent opportunity to transition from therapy back to their sport safely by focusing on sport-specific strengthening and stability.
This Sports Minute has been brought to you by the experts at Sanford Orthopedics and Sports Medicine.